back. There's a lot for us to unpack here on the show, and we're going to continue talking about limbs. You remember that more people have been asking, so what are you guys doing about the fact that people are still giving their health data manually when they visit the hospitals? We understand that government is moving to replace the National Hospital Information Management System, accusing its provider, Lightwave Health, of deliberately switching off the platform and delivering a service that is no longer fit for purpose. Lightwave strongly denies the allegation, insisting it is being unfairly pushed out of a system it built and maintained for years. So who is really telling the truth? Is a system failing elsewhere? And what happens when a government walks away from a contract it once approved, one that was signed when today's health minister, Kwabena Minta Kando, was a ranking member on the health committee of parliament? This morning, we're joined by senior project manager of Lightwave, Agyei, to try and understand the situation from Lightwave Health point of view. Very grateful for joining us here.
Thank you very much.
So
good morning to your listeners.
Why did you decide to shut off the health information management system? And under what circumstance did you decide to do that?
Good morning once again. It's unfortunate. I think the last time I was on this show, I made mention that Lightwave has never shut down our systems. As I speak to you, our systems are running.
So you're saying the minister is telling a lie?
Yeah, I think I made these factual allegations clear in my last engagement, and we were a bit surprised that after our rebuttal of the statements that he's made, he went ahead to continue in the recent accountability series the minister made, and then continue to repeat some of those allegations, which were unfounded. The system that we use, as I told you the last, I think there were about 200 plus facilities that were still running the Lightwave system, which includes some government hospitals and CHAC facilities. Subsequent to that, some of them automatically had gone off because of their disconnection from the Lightwave connectivity. That is the VPN, or the virtual private network that supports the system.
Who disconnected them?
The system automatically. Because of the recent impasse, some of the facilities disconnected the systems from the network. So once you are off the network yourself, you'll be able to work autonomously, locally.
Okay. So if I want to get you well, you said if I am hospital A,
yes,
I decided to switch off from the system.
Yes, perfectly. So how the system works is hospitals work autonomously and they all connect to the central repository. That is the service that we have installed at the first floor of the Ministry of Health. That is where backups are very important. That's where backups go. Now, if you disconnect that connection, that does the backup. System is of the tendency to shut you down after some time, because if backups are not going, there's a tendency, if there's a fire or something happening in your facility, you may lose all your data. So it is a point of call to our technical and support services to be addressing such concerns when they come up, because if you don't do, as would be the normal nature of people, let me just work, they don't care about backup, they don't care about patient travel, they don't care about the back-end activities. So if you shut the system down from that network connectivity, then after some time, if backups are not going, the system is supposed to alert you to get back to your support team to assist you in restoring. That is basically what happens. So when we met the minister in September, we told him that due to unpaid arrears and work that we have done, especially from December 31st, 2024 coming until the September, we told him that we do not have the resources to continue taking care of the 150 plus staff that we have, and that the support services was going to be taken off. So if a facility's connection now is down, which they themselves have disconnected, and the system continues to run after some time, it cuts them off for them to reach out to support. Unfortunately, once the minister has told us, or we ourselves knew, that at the end of December 31st, 2024, the contract has expired, but we continue to work based on the minister's request until September. We were providing support. We were assisting facilities. We would go, and sometime when we realize that facilities connection is down, which I will demonstrate shortly, we will alert them, and then they will do the necessary checks and then come up, and then we continue provision of service. But if we are not able to provide service and your connection has been down, which most of them confirm with messages and calls that I have received, that most of the medical students will say, oh yeah, we discussed something like that, the IT, but we didn't know the repercussions that this could happen.
Oh, so they decided to take it off, but they didn't know that
that could impact them in the way that it has. And
when they are going off, don't they inform you?
When they are going off? No, this is deliberate attempt for some of them, for reason for which I can tell. But those that have kept, that's how come I continue to say that those that have kept their connections up, they are still running, because the system, you don't need us to come to your facility to do anything.
So are you saying that as we speak, there are some health facilities that are still using your system that are not encountering challenges?
As we speak, there are some government health facilities and quasi-government, that's the CHAG facilities, that are using our systems without encountering any challenges, because they have kept their connections up. But if they disconnect and they go down and they call for support, we don't have any agreement with the ministry to provide them any support. We wish we could have, but because of that lack of any form of continuing of the work, as the ministry has not asked us to do anything, we are unable to provide that support.
When did these health facilities decide to go off?
I think after the initial, I think some of them went off before the initial, the initial engagement we had with the ministry, especially relating to the NHIA shutdown.
So you're saying everything started this year?
This year. Everything started this year. The systems have been running for close to 9+ years. And facilities weren't going through these challenges.
These institutions, how many are they?
We have about more than 450, but we want to limit it to that numbers that are out.
Those who plugged off?
Oh, they are well over 300, about 200 to 300 facilities.
They plugged off your system?
Yes.
And have you found out why they decided to go off?
Some may be due to their connectivity, maybe the wide area connection going down. So if the connectivity goes down, we have systems that I said I'm going to demonstrate, that would alert our teams of these systems that have gone off, and then we will proactively go in to assist, because we don't manage that connectivity. It's managed separately. We don't manage it. So if there are rains or there are power cuts, we will not be in the northern or southern part of any facility to know what is happening. So based on the dashboard alerts, we will now follow up, and sometimes if it is power, we guide them through these processes in restoring.
Yeah. Okay, but government says your system is not fit for purpose and has not been functioning as you tout.
Is it a minister or government? Because the system...
But the minister is a government.
Yeah. So the system is fit for purpose, and I can boldly say that we do not have any such system, even from the time of implementation until now, that does what the Lightwave Health Information Management System does.
Well, maybe we can start with your presentation so we can better understand what's happening.
So aside aside what happens at the hospitals, like the processes that the doctors use at the hospitals, we have created dashboards that we use for support services. And these dashboards we have, in fact, throughout the period, have engaged the relevant authorities, including the ministry, to take ownership and be able to manage this, because this will give you the oversight of what is going on in the country, in every facility. So I will go to the screen and take our viewers through.
So this is the monitoring dashboard?
Yes. So we have one such, which is the monitoring dashboard, which is a dashboard that would take you, it has a normal login interface that you can log in with your user credentials at the high level. We are not talking about the facility level, because when data is captured from facilities, they move to the central repository where we are able to manage these data from the facilities to get high-level reporting to the ministry, to the Ghana Health Service, or the ministry and its agencies, if I will put it in short. So as of yesterday night, we have over 26 million patients registered on the system. Now, you would see the facility names and the type of facility, and if you go, the patient visits and the number of patients activities. You see this status that indicates green, red. There are other colors like amber. That shows the state of the facility's connectivity. So if we receive a red notice, before it comes to red, it will even be amber, passive. Maybe your connection comes up and it goes down. It comes up and it goes down because there was a similar situation in Kolebu, I think 2 years ago, when a tree had grown to cover the device that was supposed to be transmitting to the base station. We had to call for Kolebu when we realized it was passive, for them to trim down that tree so that they will receive green connectivity throughout, so that backups and services that are supposed to be going outside on the facility will continue to go on. So this dashboard is available.
So the red means what? The
red means the facility has been down for some time. And then this is supposed to call us an alert for our facility. Once the facility is red, come again. This is not a plug off.
Okay, all right.
It is not a plug off.
Okay.
It is connection breaking.
Okay.
That will cause this to happen. And if the connection is breaking continuously, but it goes and comes maybe in certain intervals, it would be amber. Now, from this dashboard, we also are able to get to each facility. This is at the national level. So the minister could sit in his office, or the technical team could sit in their offices and be able to know what is happening down at the facility without stepping foot there. Okay. You will be able to know. I think we all knew about the no-bed syndrome. The minister could have logged in and checked how many beds you have in a particular hospital, that they are even sending some RTIs or patients complaining that there are no beds. We have created all this and even gave them the opportunity to let us know what indicators they want to report on, so that we can include. Because, yes, we will give you the technical side and what will benefit, but maybe you have specific, including certain areas. We will be able to put this into the reporting for you. We go on. So as you see, some of the facilities and the connectivity continues. And then here you are able to set up the facilities yourselves. The ministry could say, okay, we want to set up this hospital in the system. You're able to put all the details, so that if you are going to a hospital, from the dashboard, you know the medical soup, the IT manager, the administrators, whoever is at the facility to call, even if they change over time.
But how can they get a location, latitude and longitude?
Yeah, so this was a very key thing, because when we were doing the deployment, you would realize that there will be a facility listed on the list that the ministry will bring you. And some of the facilities didn't even exist. Some of them have closed down. So when we go on the field, we pick up the coordinates and feed it, so that if the next time someone has to go there from the ministry or from any of its agencies, they can just pick from the coordinates that we have, because this will be real-time coordinates with the facility images so that you will be able to go without getting lost.
All right.
Now, when these are some of the screens to indicate, like I was saying, client information, so you'll be able to see the email address of the facility manager, their phone numbers and all. Now, there is what we call patient PDF overview. This helps, these are part of the information that patients carry across when they are traveling. It's like moving a folder from one facility to the other, including their lab investigations, the treatments. So you could see that this patient had been at maybe Medina Polyclinic, but from a different facility. This data was pulled down in February this year. Information. I will run a live one for you to see as of today some of these PDF.
Okay, so this is as of February.
As you can see here, because that's when. So you would see some government facilities throughout that time that
so you're saying that
provide services.
With this system, if I sit, say, in Bolga, and I'm a doctor, and a patient come to me, I'll have access to this to know where the patient has been to and all of the records.
You would have access to everything that the patient had been seen in one facility and coming to you.
Okay.
And that is a unique feature in the Lightwave system. And I hear the minister always say that the Lightwave doesn't do it, but the GIMS does, but has not been able to prove, even within the facilities. Before the GIMS has been around, it's a software that had been running at the time we were deploying at just one facility. And now, if you go on their website, they were in like 5 facilities. So it's not a new thing. It is a private software that I don't know how this becomes a state-owned, other than what we have here as the LIMS.
Okay.
Because even within 37 itself, within facilities that the GIMS is running, not all departments are even connected. They are not working.
Okay.
Not even running from one facility to the other. So this tells you movement from facility north to the south, east, and west of the country.
Let's talk about LIMS
today. No, it's because you asked and click the question of the GIMS doesn't have patient travel, you don't see anything, but GIMS does.
Yeah.
That's why I brought. So we have a map that also shows you where the facilities are spread across the country. So, like I said, if you want to go, the GPS locations will be able to lead you. And then you will be able to also pick a number of facilities and want to know maybe some report. I generated this report for malaria tracking. So you'll be able to know within a day or a week how many malaria cases you have received, how many deaths has occurred out of the malaria. These are some of the reports that the facilities generate or becomes a point of interest. That's why we put them there. Okay. Again, like I said, we give them the opportunity to let us know the indicators on which they report, so that this will prevent health information officers gathering data manually and then submitting it at the end of every month for users not going to the field. Now, we have here files that also shows the movement. Like I said, when something goes off, the system tells you what is happening and where the challenge is and what you are supposed to do to follow up. Now, the second part, which is the disease surveillance dashboard, is what we use in gathering based on the case definitions that the WHO has given to Ghana, that we use in getting data from the facilities, the case definitions of maybe communicable diseases and non-communicable diseases that the WHO is monitoring in Ghana, so that these have been done in the system in such a way that as doctors are working their normal daily activities, they don't need to care about any form of reporting as they are diagnosing you, as they are picking your medical history. This data is gathered on a dashboard that tells you. So if you can see, we have the COVID alerts. Even as far back as COVID, we have the alerts dashboard interface and also the facility types. Now, this tells you about the facility, their category, and the regions when you are setting up. So these as well can be done by the ministry or the Ghana Health Service, whoever that have access to this interface. It also gives you, so as you can see, as I was telling you, at the time of taking this image, you could see some of the facilities in red, telling you that, and in yellow, telling you these are passives. Some of these are in the greater central and greater Accra regions. You could see some that don't have any activity. So this tells you we had a system that was working, a system that was picking data, real-time data, to help government to make very sane health policy and decisions, which currently only a few facilities are running. So this shows, again, like I said, data that was captured. And I want to, for now, show some videos or clips, very short clips, of users of the system since we deployed in 2016 till now. Until
I don't know how, if my viewers can have it.
Are just short videos, just short.
It doesn't have audio.
It has audio.
Because I'm looking at how our viewers can really.
It has audio, so if the team would let the audio out, you would hear.
All right. Let.
With the impact of LEMS has to do with the continuity of care, because right now you're able to access any information from another facility and then also continue from there. And sometimes there's no need to even repeat certain investigations if the time frame is within an acceptable range. So continuity of care as a family physician is a key factor for me in here. So we are able to continue with the care that we have to give to the patient. And with the integration of the NHIS and then also with the Ghana card, then it makes it much easier even to kind of enroll clients onto the system and then also be able to retrieve their data. So it has really been very helpful in that regard.
So that's one of the videos that you have more for us to see.
Yeah, just about two more.
Okay.
I don't know why the sound is off.
It will come. They'll put a sound.
Their funds will cheap for them. This is no more in the hospital, because now the IT system, the computer system is such that every patient who comes in with a digital number registration, the retrieval of the electronic record, medical records of the patient is instant, And now we are also able to do very good appointment system with the patients, because there's very little waiting time.
You had people's personal information on sheets of paper that could be handled or viewed by anyone. But now with the LIMS system, you have this in a software that you need to have certain credentials to be able to access. And so that improves confidentiality for our patients as well.
So those are the videos.
The links.
Okay.
I think it's good to hear from.
It's able to capture all clients and thereby improving the revenue generation of the institution. Through the links, we've been able to do some savings that have enabled us to expand on the ICT infrastructure that we have. Since its inception, I think we have brought over 600 computers, over 20 Cisco switches, access points, and this is all because our revenue generation has increased.
So these are some of the testimonies about your service.
Yeah.
So you're saying that there was nothing wrong with your service.
There was nothing wrong.
And you allege
nothing wrong.
And you allege that some people are pushing you out. Who is pushing you out?
I can confidently say that since the introduction.
Ministry, because based on the minister's information that he's sharing out, because we didn't have any issues with this minister, even when he was a ranking member. Yes. So, and then come into office, and then all of a sudden, this brouhaha. Because it becomes very challenging, but we've done some follow-ups or investigations into some of these activities that the minister brings up. And we are tended to believe strongly that this is pure personal issues. Because, we do not have any problem with any institution going to do an audit or investigation. But again, as I always repeat, why do you send a competitor to go do an audit? And then I think there was this 10.45 million Ghana cedis that was taken out from the Lightwave budget, from the NHIA funds that are supposed to come to us. And this money, it will surprise you. Anybody can say, we didn't take it from, but the same institution that was asked to go conduct the audit on Lightwave was paid this money in 2024. What business did the institution have with the ministry at the time to have received this money on their behalf? And also becomes a surprising when this same institution was sent out to go do an audit on Lightwave. So there is some form of hidden, some mystery, which I think it is only the Minister of Health, the current Minister of Health, that will be able to answer, because we've done our checks and everything points to one particular direction.
That there was no fault to the system.
There's no fault in the system, and if there was, this 10.45 million Ghana cedis that was released for monitoring and evaluation, M&E, it was supposed to be done by the Health Committee of Parliament. If they did that audit or they did that monitoring and evaluation and there was any report, why has it not come out since 2024 when this was completed earlier in the year 2024?
So government paid
yes,
10 point something million.
10.45 million, and that went to the company that the ministry this time now is sent to do an audit on the Lightwave system.
So I know, say it well. So government paid 10 point something million in 2024
for M&E.
2024.
Yes, when the minister was a ranking member
for
and approved it. And I think he confirmed it when he was doing the accountability series. He confirmed that, yes, when they approve, it is the ministry that determines what the money is used for. And this money, we have concrete authentication where it went to and those who took the money. So the issue is,
who took the money?
If Company X has gone to take the money and the Company X doesn't have any business to do with the ministry, how did the ministry pay that money through Company X? And why is Company X being the same company being used to audit Lightwave system in 2025?
So Company X was paid in 2024 to do M&E.
No. The M&E is specifically for the Health Committee of Parliament to do an M&E because they have an oversight. That allocation was supposed to have been used for M&E. So if you've done monitoring and evaluation on a project that is ongoing and you didn't find any problem and did not provide any report to that effect, why cry foul now? If there are any reports.
I want viewers to understand well. So you say the Kwamina Minta Conduct Committee, because he was a ranking member on that committee, were given 10 point something million to do M&E.
Exactly.
On Lightwave or just total?
On Lightwave.
On Lightwave?
Yes.
Just Lightwave?
Yes, because that was the systems that were being used at the time.
Over 10 million cedis?
Over 10 million.
2024? And they did that M&E?
There's no report, so the money went, no report to prove of any work done. And the question is, if a work has been done, where is the report? If the report was damning, bad, as he assessed today, why was it not published? If the report was good and it's something that will help Ghanaians, why was it not published? Do we have any report? I believe, even as we speak, just last week, people are calling the facilities to go back and do some other form of audit. But we were made to know that this is nothing personal. Everything is based on data that has been collected. So if it's based on data that has been collected, and as at last week, you are still going around to collect data, then what was the initial information based on?
Okay.
These are questions for...
So that's 2024. 2025, you claim that the ministry has contracted a company to do monitoring again on your system.
On our system.
Another monitoring 2025.
But okay. The thing is, the monitoring and evaluation, the monitoring is not for a company. When, at the time, in 2024, it was for the select committee on health to go, because they approve budgets.
Yes,
so they need to go there to see what is going on.
But what's the difference in 2025?
2025, it's a company. To do it.
And not the health committee.
Not the health committee. And this company, X, is the same company that was paid the money that was paid to have gone to the health committee. Why did that money go to this company X? The money went to this company.
So in 2024, the money didn't go to health committee, it went to the company.
It was paid through. It was paid to the health committee through that company.
And this company has been contracted to
do the same with interest.
But the government was against the monopolies you were enjoying. Isn't it better when we don't have to monopolize such a system?
Unfortunately, that assertion is untrue. Now, health data or health in Ghana, through the introduction of the LIMS or the Lightwave system, was going on very well because the facilities attest to the robustness of the system. Now, monopoly, as people may put it, is that there is no, any form of data exchange. And after we have deployed over the time, in fact, we impressed on the ministry when we were doing some form of integration with the GILMIS, that's the stores management system, to provide such exchange, which we provided service. We provided service and infrastructure for this activity so that any institution that wants to plug in will not plug in directly, but through the exchange. This never materialized. And I was happy when the minister said they have that exchange. So if you have, but again, it doesn't exist today. If you, the minister can prove to us there's any exchange that exists, that any facility or any vendor can connect to, then they should, why would you then, if you have an issue with Lightwave, why would you then let someone go do the same work that Lightwave has done? Then the 500 that you said Lightwave is remaining, send people to that 500 facilities, plug them to that exchange so that you get your data from the 500, you get your data from the Lightwave. That doesn't exist as of today as I speak.
So as of today, how many facilities are you on? 100?
Come again?
How many facilities is Lightwave working there?
Lightwave is working in as much as over 200 facilities.
As of today?
As of today, including CHAG and government facilities. The data I showed you, the very first screen that has the over 26 million, has live data of government facilities on there.
How much are you still owed?
Come again?
How much are you still owed by government?
We have about 78 so far that, oh, you mean in money?
Yes.
In monetary terms, we have, I think, about 25 million USD that the government owes. And then also, there are, I don't have the figures here, but I know the minister, per confirmation, said work from, what is it called, the time we came into January till the September, and we are going to pay. We've sent invoices, and nothing have been heard from them. Okay. So what we are most interested in is helping the Ghanaians understand how the Lightwave system works and how it has come, or it came to benefit. But now there's a cry that we have shut down systems. We haven't shut down any system. Systems are working. Those that have kept us on are working. Just last week, the regional hospital in is it Western Region, Efiankwanta, I received a call, and they said, can we get this? We didn't know. The system is now down. Before, about a month ago when I was in your studio, I used the Efiankwanta and some other facilities as examples of facilities of government hospitals that are working. But they didn't know that that connection that they have taken off will eventually cripple their system.
Okay.
And that happened, and today as we speak, they are down, and they called that, can we help. And I said, once we receive approvals from the ministry to provide any form of service, we will be able to provide service and provide the necessary support. And before I finish, we want to put on record that Lightwave does not intend to malign or do anything wrong untoward with the ministry. We have, through our lawyers, sent an arbitration to the ministry so that we get a third party to try and resolve this, because this is about the Ghanaian people, it's about the Ghanaian patient care, which is crucial.
So you don't want to take any legal action against?
There are steps, but we have sent communicate to the ministry. We have sent copies to the Office of the President through the Chief of Staff and the Ministry of Health. But as we speak now, no feedback has been heard, meaning they are not ready to even invite a third party to try and settle matters.
Eventually, will it go to court?
Yes, if it gets there, we will. Because there are steps, like I said. If someone is getting you to a certain angle, yes. After all, the minister said he has sent information to the OSP, to the Agyei, to Yoko, NIB, for them to advise. And so if that is the way the minister, then there is a highly possibility of some judgment debt, and this can only be addressed by the courts of law.
Okay, so we will be seeing Lightwave going to court. When would that be? 2 weeks? 1 week from here? 1 month?
Like I said, there are steps. I mean, you want some feedback or answers from me. The minister said he was going to complete the 450 that we have done in 1 month. When he did the, what is it called, Meet the Press at the accountability series, how many out of 1 month, 450, you know the number he put out? 20. 20. And even the 20, not every department in the facilities are working.
You mean 20 connected to the new system?
No, 20, yes, 20 connected to the new system out of, he said, give us 1 month and we are going to do all 450. 20 has been connected, and even that 20, as I say, it works in only OPD.
Okay.
People move from one location to the other, they continue on paper. He said each facility that Lightwave did, out of the 950, we've done 450, and they are nominal values that we have done less than 50%. Today, on an already implemented platforms and everything, just deploying the games, he says, the teaching hospitals, we are doing them department by department. So if you are doing department by department and not seeing it as one,
all right,
it makes the point of the 450 being less than 50%.
Eric Agyei, I'm grateful to you for
Thank you very much.
He's Senior Project Manager of LIMS, or Lightwave Health Service. We'll take a break here. We will be back with more. Please do stay.